Cordotomy and neuropathic pain. So the current definition of neuropathic pain is a pain arising as a direct consequence of a lesion or a disease affecting the somatosensory system. Neuropathic pain can originate from peripheral or central nervous system damage. Following an injury, the damaged nerve attempt to regenerate, and this can cause neuropathic pain. And it is associated with several distinct characteristics. They're often abnormal, feel unfamiliar and very unpleasant, such as some sort of shooting, lacerating, or burning pains in the absence of tissue damage, which is important to know. Stimuli that are normally non-painful cause a pain, and some experience hyperalgesia, which is a condition where the pain messages from a mildly painful event are greatly enhanced. And neuropathic pain conditions have several possible mechanisms which express different phenotypes and clinical presentations. Neuropathic pain can be divided, as I said, into central and peripheral neuropathic pain, of course, depending on which part of the nervous system is involved. And peripheral neuropathic pain is sustained by peripheral nerve lesions that can have various types of presentation. In particular, among the multiform pathophysiological expressions, one of the main differences is based on symmetrical or asymmetrical pathology that makes the painful clinical syndrome. And nerve lesions associated with neuropathic pain can be, as I said, symmetrical, for example, polyneuropathies, or asymmetrical, like the herpes zoster neuropathy. And only asymmetrical nerve lesions sustain the unilateral neuropathic pain, which can be treated with cordotomy, which we'll talk about in a minute. There are several forms of unilateral peripheral nerve lesions. They can be divided into mononeuropathies, radiculopathies, and plexopathies. And the most common clinical presentation is mononeuropathy, for example, a lesion involving only one peripheral nerve, like, for example, the median nerve. And this is common in the carpal tunnel syndrome. Another common clinical presentation of unilateral peripheral nerve lesion is the radiculopathy, a frequent consequence of an intervertebral disc herniation or other pathologies of the lumbar or cervical spine. We have plexopathies, which are rarer than other unilateral nerve lesions, and the most frequent is brachial plexopathy, that is commonly caused by trauma or disorders involving neighboring structures there. As you probably know, pain is a common problem for cancer patients, and usually it is treated with opioids or steroids or other painkillers, but some cancer patients have a pain that fails all those medical management. And in these patients, particularly those with a progressive disease and a terminal prognosis, neurosurgical procedures can be considered, like a cordotomy. So, as we know, the spinal cord is central to the pain pathway. Spinal procedures are then a possible choice for those patients with such severe pain. We have open and now more commonly percutaneous cordotomy, which is best suited for patients with malignant unilateral limb, pelvis, or tract pain. And cordotomy has the aim to destroy the pain-conducting tracts of the spinal cord. Percutaneous cordotomy can be performed without general anesthesia, and this is a significant advantage in the cancer population because they usually suffer from comorbidities. And also what is good is that percutaneous cordotomy allows the practitioner to perform a test lesion, which improve the success of the procedure compared to open cordotomy. And usually the lesion is made in the cervical region at C1 to 2 with an heated electrode with 2 millimeters of exposed tip, and it is heated to 70 to 80 degrees for 1 minute, and this creates the lesion. And as we know, nerve pathways cross to the opposite side at this point, and so the pain relief occurs on the contralateral side of the body, and the pain relief will last for about a year. The good thing is it works for about 90% of patients treated with this technique. And you might say it's sad or a disadvantage that it only lasts for 1 year, but once more, it is best for patients with a terminal disease, and probably or mostly 1 year can be a great success as in terms of life quality.